Peter Ducey, good stuff. Thank you. For more on all of this, let's bring in Republican Senator John Barrasso of Wyoming, chairman of the Senate Republican Conference, who worked as an orthopedic surgeon for 24 years. We just want to remind our audience of that so they know you know the inner workings of the medical and insurance system. Let me ask you, Peter Ducey said Republicans were viewing this as a gift. Is that how you see it?
Well, this is now the liberal litmus test of the liberal left of all the presidential candidates, Melissa. And the first step of this is to take a wrecking ball to the health insurance that 180 million Americans get through work. So that, to me, is a big thing. And then with what Bernie Sanders is talking about doing, a complete government takeover of health care. You know, that leads to higher taxes, it leads to a loss of freedom, and much longer lines as people have to wait in line for care.
But at the same time, you guys tried to repeal and replace, it didn't work. And Democrats are leading the way in health care right now. It seems like you guys have to offer some sort of solution in a real sense with some legislation. Are you close to that?
Well, we have, as you know, eliminated the mandate, the penalty for people that didn't buy Obamacare insurance. We've eliminated the gag order on pharmacists, so patients can talk to their pharmacists. That has lowered the cost of drugs for American citizens. We have in place these plans, these association health plans, to allow people to join together and buy insurance that's more affordable to them. So we're taking all of the right steps to lower the cost of care.
But you have to take some big steps. I mean, if you look at the Kaiser Family Foundation says that 5% of the population uses 50% of the health care. A lot of people have proposed the idea of taking those people, putting them in a high-risk pool, targeting the federal dollars at those folks in particular. You could even reinsure it to lay off some of the risk from the taxpayer. That would be a big move that could come in and make a change. What about that idea?
Well, I think it's an excellent idea, but as you know, the Democrats aren't interested in finding solutions which should actually work in a practical way, with Nancy Pelosi in charge of the House and Bernie Sanders leading this group, this sharp turn to the left. What we're seeing is their goal is a complete government takeover of health care in America. And in his statement, Bernie Sanders talked about Canada. I will tell you, as a surgeon in Wyoming, I have operated on patients from Canada who, rather than wait for free care in Canada, came to the United States to be cared for because they couldn't afford to wait the length of time. Right now in Canada, after somebody sees a family doctor and is referred to an orthopedic surgeon, which is what I am, it's 8 months of delay. The American people are not going to tolerate what Bernie Sanders is promoting.
Without question. But let me push back a little bit there, sir, because you mentioned Nancy Pelosi, and she's someone who's not on board with Medicare for all. So it seems like maybe there is an opportunity in the House. I mean, what if you put forward, if you can't get a whole plan across, you mentioned some solutions that are in place. Why not try for one more, like the idea of taking these people off and pointing the federal dollars at them or something? I mean, it seems like there's room in the House because Nancy Pelosi realizes the fallacy in Medicare for all.
With the Democrats running for president, who want to run the country, want to have a complete government takeover of health care. I want to continue to work in a bipartisan way with senators and House members specifically focused on doing things like stopping this surprise medical billings. I think we can find bipartisan support for that. Because look, as a doctor, I want to make sure people can get the care they need from the doctor that they choose at lower costs. I mean, to me, that's what my role is as a physician, trying to help people, making sure that people with pre-existing conditions can continue to keep their coverage. So there's a lot we can do, but the reality is a complete government takeover of health care will lead to higher costs and less freedom and longer lines.
We're looking forward to you legislators doing your jobs there, writing some laws on this to help us out. Thank you for your time.
Thanks, Melissa.
Dueling